I was just telling Mary I had some really bad low back pain a couple weeks ago. I mean, it turns you into an old man real quickly. I'm glad to be better now.
Yeah, well, that happened for you. Like you were working out at the gym, maybe you've been there. The pain doesn't go away quickly for everyone. It might last months or even years, and it affects every single aspect of life.
Brad Albrecht knows that all too well and he's here with Dr. Drew Drummond from the Spinal Balance Health Center. Brad, good to see you guys.
Nice to meet you.
Well, Brad, you had some,
Thank you.
I don't know, I had some low back pain. It can be miserable and it can be debilitating. Describe your condition.
It was so bad that I was missing work days at a time. I couldn't get out of bed, just muscle spasms left and right. Went to a bunch of different doctors, tried to figure out what was going on. So they just prescribed me medicine. So I tried to go a different route. Met him at the golf show, and it's been completely different since.
So what was it about what he said that caught your attention?
Well, we met with this little contraption that shows your uneven shoulders, and that kind of got me thinking that if everything's aligned better, maybe he is making sense down the road.
Just maybe. Just maybe. Doctor, doesn't make any sense. Yeah. So you met him, and what type of treatments did you go through? How quickly did it get better?
I'd say about 2 months. I felt a huge difference. I felt myself my posture getting taller, and the lower back pain went away almost a month after seeing him.
And you couldn't golf?
I couldn't golf at all.
And golf isn't just a hobby for you?
No, I actually went to school for it, professional golf management, and it was kind of depressing not being able to get out there and swing the club.
It's your thing.
Right.
This is your passion.
My
it's
biggest
your
hobby,
career.
Right,
it's everything.
Are you playing better now?
Much better. Much better. Consistency.
Yeah, which is why we joke, Dr. Drummond, that you are not a swing coach.
Yeah, no.
But yet he's seeing a huge difference in his swing because his body's moving better again.
Yeah.
So what's interesting about you is that you treat upper cervical misalignments.
Yes.
Why something in the neck can affect for him low back pain.
There's a kind of a peculiar bone at the top of the neck called your atlas, and it's a very mobile bone. It's what moves the head around. So through accidents and injuries, this little tiny bone becomes misaligned, and then it breaks down the communication between the brainstem and the back muscles. And this is how we coordinate our posture. It's through our nervous system. So I've got a picture here that shows what normal would be versus not normal. And on the right-hand side, if you look at this person's shoulders, Brad mentioned shoulders that I looked at the golf show, and this is why. Even shoulders, even hips, even legs. This is all normal when the muscles are pulling evenly on the framework. But on the left-hand side, what that's depicting is muscles on the right side of the body that are tighter than the left side. And this happens because the nervous system is not controlling the muscles anymore. And if you look way down to the bottom, the leg is short. It pulls a leg into a short position, which then forces the body to go through a series of adaptations.
I see the hip bones, and what I know about my husband, who's turned pro after college and still works in golf, and the importance of the hips in a golf swing, and when things are messed up there, how it affects your swing in major ways.
All those rules that your husband learned, that Brad learned about the golf swing, they are centered around a symmetrical posture, a symmetrical body. So when you're not symmetrical, it throws a swing off to where there's all these little adaptations people have to make, and then it just,
And that's why your swing was all over the place. When you said, Brad, that you were more consistent now, it's because of the symmetry for your body at this point.
And Brad had tried a lot of different things. How come none of those worked, but what you did seemed to fix him?
What doctors and therapists were focusing, or through what he got over the counter, it's all focusing on pain relief. It's looking at the low back. And the low back, in the case of posture, if the body is slightly off its center of gravity, we have these very dynamic areas of our spine that will adapt to get us back upright, just like if you're carrying a suitcase or something like that. You don't pick up a suitcase and fall over. You pick up the suitcase and then you adapt, and the low back and the neck are two of those areas. So as long as the low back is adapting in the way it should, it's really doing its job. And you can't force the low back not to do its job through a low back treatment. You have to look at the whole body and get it balanced out. And for most people, it's the top of the neck issue.
So it's not uncommon. Not uncommon for that top, the atlas at the top to affect the lower back.
I see a lot of new patients on a weekly basis, and the most common symptom that they come in with is low back pain. It's by far the most common because when the posture is off, that's the area that adapts. And most of them have been treating it for years through low back types of therapies. So it's the most common to come in my office. It's also the most common to get better. I don't remember the last time a low back issue didn't improve at least or usually significantly to where it just doesn't hurt anymore.
So Brad, for you, how long were you suffering, do you think, from what you would describe as low back pain?
It consistently got worse and worse, actually. So when I went in there, it was to the point where it was happening every other month almost. I was getting back spasms. So
and you think this all started from a football injury back in when you were younger?
Yeah,
high
that's
school,
when
huh?
that's when it started, and then it progressively got worse. I think with my golf swing and all that stuff being imbalanced, probably just created a worse and worse problem.
Where your low back was doing its job, as Dr. Drummond.
Yeah.
And I've heard you say that before. It could be from an injury that from like when you were a kid or even at birth.
Yeah,
Right?
yeah. There's any number of accidents that can do it. Watching the football game when Tommy hit his head and got knocked out, first thing I was thinking is, oh my gosh, he's got to misaligned his atlas there. Yeah, it could be anything.
Well, Brad, I'm wondering now that you feel better and you sort of feel like your life to some extent has been restored, have you recommended it? Would you recommend
Most
NUCCA Care to other
definitely.
people?
Yeah, at least give it a shot. I mean, it could help you in so many different ways than you'd know.
And I like that you were skeptical in the beginning, you know, and that sort of like
always
saying
gotta
is
be. Well,
believing.
Well, most people are, aren't they,
Yeah.
doctor? Most people are
When something is as unique and unusual as there's only 200 or 300 doctors in the world that do this. So when people are actively looking for a low back care or pain solution, they go to any number of people that will tell them something completely different than this. So then when you finally meet somebody that seems like they know what they're talking about and it makes sense, you're still like, okay, I'll give it a try, but I don't think this is going to work.
No pills and no surgery.
No.
So if those are two of the things that you're like, man, I can't do that, this makes so much sense to just try it, especially with a special offer that Dr. Drummond brings to us. The first 15 people who call, and I don't know that you got this deal at the golf show, Brad, but for the morning blend, if you call right now, you'll receive an x-ray, an exam, a consultation, that whole bundle for just $50. And the number is 402-452-3400.
Yeah, like we said, right? No more medication, no more ibuprofen.
I don't take any Advil or ibuprofen or anything.
That is awesome. Thank you for coming in and
Thanks for
sharing.
stopping in, yeah.
Good to
Thank
see
you.
you,
Good to see you,
Dr.
Doctor.
Drummond.
Yes.
Always a pleasure.
For the
Thank you
8th
very
year,
much.